There is no specific medication as of now for core symptom of autism. Children with autism, since they have communication issue, they are not able to express their distress. So the way they express is through behavior. Integration into mainstreaming school not only just depends on speech and social functioning, it also depends on adaptive behavior. See, for a school, okay, they are accommodative, so they want to accommodate, but at the same time they want serious significant behavior issues to be under control. If that is manageable in the school, they can be in the mainstream. There comes the role of medication. The role of medication is to assist the child until child learns the skills. So for example, a child, once they start learning the more functional speech, more functional behavior, they are able to communicate, they are able to express, the need for the challenging behavior automatically comes down, and need for medication will also come down.
Hello, and welcome back to India Autism Center podcast, your trusted space where conversations about autism it moves beyond stigma, misbelief, confusion to clarity, care, and evidence-based practices and understanding about autism. I'm your host for this session, Pooja Datta, and today we will be delving into a very critical yet important topic that almost many parents who are having children in the spectrum they face conflict in. We will be talking about medication and its importance or how important it is in autism. And for this, we have with us an expert who is having years of enriching experience in psychiatry, in neurodevelopmental conditions, and definitely for individuals who are in the spectrum. Yes, we have Dr. Praveen Kumar with us. Dr. Praveen Kumar, he is the head of the neuropsychiatry department at the Institute of Neuroscience, Inc. And he has intersected, in his profession, he has intersected psychiatry, neurology, and child development. So, sir, it's a pleasure to have you again with us at this platform. How are you?
Yeah, I'm fine. Thank you. Thank you for inviting me for this podcast.
So, doctor, as I said, to begin with, one important question. Autism is a condition, so it is not curable. So, how come medicine is needed in treating autism, or rather in treating the symptoms of autism, or how psychiatrists with medication they help individuals with autism in the spectrum?
So it's a very important topic. What's the role of medications in treating children with autism spectrum disorder? Now, first of all, we have to understand that, now, treatment of autism, uh, it's a it's a multidisciplinary approach. So it starts from first important is suspicion. That means a child is showing some symptoms of autism, suspicion. Second important thing is diagnosis. Is it actually autism? That is very important. And early diagnosis. And third important thing is what are the medical conditions associated with that, and what are the other investigations we had to do. Some children need some investigations, medical investigations. And fifth important thing is communication of diagnosis, educating the family members, and the therapy. So the sixth aspect is giving them the plan for the treatment. That means so what are the different therapies available, and the role of medication, it's on the bottom list. So it's on the pharmacotherapy is on the bottom list of the management of autism. So that means it is not the first line of treatment for autism. Although therapy is the main treatment. What is gold standard treatment for autism? Early intensive behavior therapy. That is the gold standard treatment for autism. That means early means as early as possible. Intensive means like we roughly say 25 to 40 hours per week, this kind of therapy that includes therapist time, parental time, and all. So for a period of 6 months to 1 year, at least for a year, so improves the autism symptoms. Now, when it comes to medications, so the role of medication is like, when children are having symptoms which uh, which are like, for example, child is having a severe aggressive behavior, or say severe self-injurious behavior, or significant hyperactivity, or repetitive behaviors which are very significant, to an extent that is interfering with respect to the educational interventions or behavioral intervention. So that means when the behavior problems are so significant, uh, that is causing the child, like, so child is not able to sit for the any therapy, or for the say in the school setting. Now behavior problems are so significant that child is not able to sit in the school, and behavior issues are very significant. And also this is not just only the behavior issues. So first important thing is, now after therapy also the behavior issues are persisting. See, there are two things we have to address. One is skill deficit, another is problematic behavior. When we talk about treatment, skill deficit means, see, for example, child is having speech delay, social difficulties. So you have to improve these skills, so that is one form. So you target with the speech, so social skill training, OT, all those things. And now there is another set called problematic behaviors. Problem behaviors means, as I said, like, the severe tantrums, severe aggressive behavior, sensory behaviors, repetitive behaviors, these behaviors. So these behavior also, like, first we try to do with therapy, behavior therapy. That there also, even in problematic behavior also, it's not the first line is medication. There also it is a therapy you have to do first. Like, it's a part of behavioral therapy is functional behavioral analysis, what we say. Functional behavioral analysis means you have to do the basic ABC chart. How frequently these behaviors are happening, what are the antecedents, in which situations these behaviors are happening, and how these behaviors are persisting, and what are the reinforcement happening. So we have to do a proper behavioral therapy. First important thing is, like, say for example, let's talk about self-injurious behavior. See, self-injurious behavior, when we talk, so first important thing is, it's not the medication that's the first thing it comes into. You have to, as I said, functional behavior. So what you do in functional behavior analysis, you see what is the purpose of the behavior. See, SIB can happen because of the four reasons. Say a child might be having attention, so they want to get an attention, so that's why they do self-injurious behavior. Second, it might be due to escape. Child is finding a particular task is very difficult, so to escape from that, so child starts exhibiting self-injurious behavior. Now third is tangible. Child wants something, you're not giving that. Now child starts hitting himself or others. So then, oh, don't worry. So you give the object. So to tangible. And fourth is sometimes sensory. Without any trigger also child is hitting, because hitting itself has become a sensory issue. So you have to first address these things, these behavior. What is the reason why the child is exhibiting self? So what we do is, generally, so we look for these, what are the causes, and we ask the parents to just for 15 days, you just note down in which situation he is exhibiting self-injury. So they will come to know this might be the, say, child is, say, particularly in a particular task, while writing task or particular task. So you have to see what is the trigger. Now you try to address those triggers. Like, for example, if it is for attention, so you give positive attention intermittently, so that child will reduce the self-injury. So that means you involve them in lot of activities, so that they are getting attention and SIV comes down. Second, if it is for escape, now child is finding if this task is difficult, say he doesn't want to do 10 tasks, you reduce the task, make it easy, self-injurious behavior will come down, or give them a frequent breaks, it will come down. Third is, if it is for tangible, then ignore certain things. So once you try these behavioral therapies, but despite that, self-injurious behavior is very significant, and it is injuring, like it is like a damaging, so child is hitting his head very badly, and it is persisting despite therapy. There comes the role of medication, you know and the medications helps to reduce these behaviors, so that they are at less risk for injuring themselves or others, especially in adolescents population. Similarly, hyperactivity is a major concerns for a common child. So they come to the doctors. Why they come to the doctors? So two or three reasons. One is problematic behaviors are significant. Sir, doctor, I'm just doing all the therapy, but he's not sitting at all. He's not sitting at all to cooperate for the therapy. Cooperate for the therapy means like, so he's not sitting in the class, he's not sitting in the even the therapy room. uh, so what you do, hyperactivity is also the same. First you do the therapy, say you do OT. We do not recommend like the medication as the first line for the any hyperactivity. You start the OT, you see hyperactivity, it is coming down. So most of the children, they do get better when they are engaged. Lot of time, you give them lot of physical task, lot of energy channelizing task, OT and all, so hyperactivity comes down. Now a child is taking OT, despite that hyperactivity is very significant, which is causing impairment with respect to in the school. See, we have to remember that the it is success of a child integration into mainstreaming school not only just depends on speech and social functioning, it also depends on adaptive behavior. See, for a school, they want also child, okay, they are accommodative, so they want to accommodate, but at the same time they want serious significant behavior issues to be under control. If that is manageable in the school, they can be in the mainstream. There comes the role of medication. So you help the child so that to that aggression or hyperactivity is at manageable level, so that they can be in the school, they can be in the therapy, they can learn the educational intervention. So role of medication is not to make them sleepy so that they are not going to school or they are not attending the therapy. Then the role of medications, the purpose gets changed. So your role is, so that's why the lowest effective dose, that is what we see, you give as minimal as possible, as lowest as possible dose, and always combine. It is not the medication alone. As I say, I want to emphasize, parent training with medication also reduces the medication dose. Say for example, there was one study which they give just risperidone to children, and they give risperidone plus parent training to the children, and the dosage of risperidone required in to manage behavior issues in this population was higher compared to the population where risperidone was also given in addition to parent training. That means if you combine the therapy with medication, need for medicine dosage will be low. So so what I want to highlight is, so medication role is to help these children so that they can participate in educational and therapy interventions, in the school interventions. And there are some children, when especially when they are around adolescent time, they are prone for a lot of aggression, significant self-injurious behavior, severe tantrums, and this is the time, and also these children, when they reach adolescence, sometimes they also like other normal children, they can develop disorder problems like anxiety, depression, mood disorder. So we need to treat, so it is treatment. So if you ask me what is the role of medication, there are two main indications. What is one? First indication is to manage behavior issues which are persisting despite therapy and which are causing significant impairment in his school or therapy, say, or in the home context where he is not able to participate. So that's the indication for medication. What is second indication is to treat comorbid psychopathology. That means these children sometimes they can have comorbid psychiatric component. Also, so psychiatric component, I mean to say, these children can have, say, as I said, anxiety, depression, mood disorder, ADHD. So you have to treat the comorbid issues, and also, as I said, severe aggression, severe self-injurious behavior. So these are the areas where you think about medication. And when you talk about medications, so the good thing is there are only two medications which are FDA approved for treatment of behavioral issues. That means FDA has said there are two medications which are safe and effective for children and adolescents with autism. And what is the indication they have said? They have specifically said the indication. You can give risperidone for children from for severe aggression, severe self-injurious behavior, severe tantrums, which are not settled despite therapy. So you can use the medication. So there are only two medications which are safe and effective. One is risperidone, second is aripiprazole. These are the only two medicines which they have done a lot of studies across the world, and they have found that these medications are safe for children with autism and effective for behavior issues. Now, having said that, so that means all medications need monitoring. So because children with ASD are prone for side effects. All medications have some side effects. Now you need to monitor those side effects. So like periodic checkup for, so say for example, if you take risperidone, now it's a very good medicine to improve the behavior issues. Now what are the some side effects? Like all medications you take, say any antibiotic you take, you get gastritis. So sometimes you take antacid with them, like that. So risperidone sometimes can cause initial sleep issues, so initial sedation. So maybe initial few days you might feel child is feeling a bit drowsy or sleepy. So that can be an initial thing. And sometimes that's the sometimes children might have a bit of weight gain, little bit weight gain with risperidone. So and similarly with aripiprazole also, like you see some children might have, say, initial vomiting. So there are some initial side effects, and so weight gain is comparatively less with aripiprazole compared to risperidone. So these are the things, we need to monitor for this. So each visit, whenever child comes, we have to monitor their weight, their height. So is there any significant weight gain, we need to monitor. And say every 6 months, 1 year, we do some routine blood test. So 3 to 6 months we do some routine blood test like CBC profile and some routine blood sugar, cholesterol. So when these children are on these medications for a bit a longer time, we need to monitor these things.
Sir, with this regard, many parents, they ask that these severe behavioral problems, why aren't they being managed or why aren't they getting improved with intensive behavior therapy? Why is medicine needed? Sir, in this regard, what is the role?
Yeah, so as I said, like, see, there are some behavior issues are, see, like for example, aggression. Sometimes children are, very aggressive, but you have to see there are a lot of causes why these children have behavior issues. Now, as you rightly said, why child is not settling, with behavior therapy. So there are causes for behavior issues. Now the major cause, first important cause, is since children are not able to communicate, they express their distress through behavior. See, I and we can say that I'm feeling sad, I'm feeling upset, I'm bored, I don't want to do it, I'm frustrated, I'm not able to take this. But children are with autism, since they have communication issue, they are not able to express their distress. So the way they express is through behavior. So aggression hesitation sometimes just can be a part of they are not able to take the load. I can give you an example, like say for example children with, so those are on mild autism spectrum, and they are having a lot of say coming exams, there is a lot of writing, and just they are not able to take the pressure, so the moment tantrums will increase. So I asked the parents, was there any recent increase in the pressure, be it be writing tasks, be it be some academic task there was. So I asked them just to reduce the academic task for the next 2 weeks, no new learning for 2 weeks. Once they settle, you start slowly introducing the new task. That means, so aggression can be a reason because they are not able to communicate. That's the major challenge. And the same thing, sometimes even aggression, you see, like they might have medical issues. Say for example, child is having a dental pain. You're doing everything, all behavior therapy, but the problem is somewhere else. Child is having ear pain, and you're doing the behavior therapy, you're trying to wonder where is, but you're not treating the thing. So that's why it's also not just putting everyone on medications like risperidone or ibuprofen. We have to find what is the cause. So as I said, sometimes children might have medical issue, that is the cause for emergency. That's how they come up. You see, constipation, that sometimes that triggers the behavior issues. So you have to also be careful about what are the underlying medical issues, anything is triggering these behavior issues. So one, as I said, communication. Second, as I said, one is second is medical issues. Third important thing is change of routine. I ask the first question whenever child comes with behavior issues. Two questions I ask. One, as I said, first, was there any recent increase in the pressure academic? Second thing is like any change in the environment, because these children have difficulty in transitional. Whenever there is a change of routine, change of environment. Say they were very good with a particular teacher in the class, and the class teacher changed. They were very good with a particular maid, and the maid left. They were particularly so they were going to a school on a particular route, the route changed. These might be the we feel this might be the they were attached to a very good friend, and that friend left. Maybe that incident has happened 1 or 2 months back. The behavior things we are seeing now. So it can be due to environmental change. So because the same thing comes up, so any change in environment can cause trigger behavior issues. And the fourth important thing is sometimes, the, as I said, the change in the so like adolescence age group, once they reach adolescence, like in normal adolescence we see more of a argumentative tendency. They have their own opinions, they become agitated, irritable, they have strong opinion like that. Children with autism, when they reach adolescence, although they are not able to tell, but they express their this one through aggression, and like the hormonal changes which occur in normal children also occurs in the children when they reach adolescence, but they don't know how to express it, how to this appropriate sexual behavior. So that is a difficulty. So we have to teach them public privatization. That is very important, rather than stopping those behavior, as it is normative thing which is happening in them also. So it is just they need to be taught about public privatization. So adolescence is one area. Once they become bit aggressive. So these are all causes. But sometimes, some children, especially on those are on the severe spectrum, very moderate to severe intellectual disability or severe autism spectrum, they tend to have a lot of challenging behaviors. And at times it becomes very difficult for a family member or for a parents to manage. I see adolescents sometimes to such an extent they are unmanageable, they are very aggressive. Parents find it very difficult. Sometimes we need inpatient care, because aggression is just it becomes unmanageable, and as I said, when they reach adolescence, sometimes they might have mood disorders, that can also precipitate as severe aggression in them, anxiety. So all these things can contribute to the unmanageable aggression. And that's the time where we think about, yeah, despite therapy, the aggression is persisting, and that's the time where we give medications. And as I said, there are only two medications which are safe and effective, and risperidone and aripiprazole, because there is a lot of scientific data for these two medications. Yes, these children helps not only they are effective for treating aggression, self-injurious behavior, and severe tantrums, not for speech and improving social. That also we need to remember. These medications, there is no specific medication as of now approved or evidence for core symptom of autism. What is core symptom is to improve the speech and social skill development. As of now, we do not have a strong evidence for any medications. All what are the medications, which are these two medications, they help to manage the behavior issues, and sometimes even just managing behavior issues helps to a lot extent, so that a child can cooperate for the educational interventions. If child is not having behavior issues, that's a very good for the school. That means children, teachers can manage them, parents can manage them, and children are learning. And it is not like once they are on medication, that means they have to continue on medications for a prolonged period. There is no proper what is that guideline as how long you need to continue, but what is general recommended is you give medications for say 6 months to 1 year, then you try to reduce, taper, and stop it.
So, sir, is it a myth that parents they apprehend, or many people they say
Yeah.
that medication is
Yeah.
addictive? Psychotropic medications are addictive. It
Yeah.
cannot be stopped. Children get habituated and addicted to these medications.
So these are not addictive. That is very clear, because these two are a group of medications which are not addictive. That is one. Second important thing is, as I said, see what is the you medication role is you assist the child until child learns the skills. The role of medication is to assist the child until child learns the skills. So for example, a child, once they start learning the more functional speech, more functional behavior, they are able to communicate, they are able to express, the need for the challenging behavior automatically comes down, and need for medication will also come down. That's the thing. So it's not like we, once they are on medications, means they have to continue for an indefinite prolonged period. No. So as I said, like every 6 months to 1 year, we have to, as a clinician, we have to think, is there any ongoing need for this medication in this child? So if the child is managing well, behavior issues are under control, we reduce the medication dosage, and even we stop. Because a lot of children, once and also we have to remember that with age, lot of behavior issues will come down. Say hyperactivity. So every 2 year, 25% of hyperactivity comes down with age. Say 4 year, a child is so much hyperactive. By 6 year, it is 25%. It is down. By 8 year, another 25%. It is down. So by 8 to 10 years, most of the children are not hyperactive. By 12, max 12. So your job is to just assist these children, so that until when they are, when there is a natural decline, so that like these children, once they are into the mainstreaming, like they are with in the school, they are mixing with other kids, they are taking therapy, and that's a positive for them. So so that is what it is. Not like once they are on medication, and these are all not like they have to be, these are all not a conditions where they need to be given medications for a very long period of time. No. So it is unlike psychiatric illness, so where that illness needs to be treated for a very long period of time. These are all behavior issues, behavior issues, challenging behaviors, and there is not like they need to be continued for a very long period of time. No. So you decide every 6 months to 1 year whether ongoing need for medication is there, and you also see if there is naturally hyperactivity is coming down and behavior issues are coming down, you can reduce the dose, minimize the dose, keep lowest as much as possible. So that is what we have to plan. and we also do some routine blood test every 6 months to 1 year, although it is very challenging to do blood test in children with autism. But at the same time, yes, it's always important to look for, as I said, medical reasons. Sometimes everything is not behavior, so because we have to, as a clinician, we have to see what is beneath this behavior is important. Is it medical reason? See, sometimes child is having, say, medical issues, it's all only sometimes we have to do periodic blood test like we do in adult. So when any child is on medication, say once in a 6 month, once in a year, some routine blood test, if it is done, I think that's it. That will help the children, so that we can, and we have to monitor some of the side effects. Sometimes when children are on medication, say for a 1 year, 2 year, sometimes they are prone to have kind of a tremor, all those things and all. So we need to monitor carefully for these any side effects, and accordingly adjust the dose or reduce the dose. That's the thing.
Before moving on to the next question, please have a look at who we are at India Autism Center.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
Now, coming back to the podcasts. So, few therapists, they are asserting that medicine is not at all needed in management of autism. What do you feel, sir? Why this belief is so much growing nowadays against medicine?
See, one important thing is every child with autism doesn't need medication. That is very clear, and most of the children, they do not need, most of the children, see, children with a lot of challenging behavior issues and all, they need help of medications. See, a lot of children, they just do have, say, speech and social difficulties, and they do not have behavior issues. Hyperactivity is not there, significant aggressive behavior is not there, significant, see, medication role is defined, and there is a specific target symptoms for which only there is a role of medication. It is not for all the symptoms of autism, as I said. So what is important is, a lot of children, they do not have significant behavior issues, and it is about just only speech and social delay, and sensory behaviors are there, but that is manageable. So these children do not need any medications. If they are on a proper therapy program, proper this one, that definitely helps. But at the same time, there are some children where they need help of medications. As I said, like severe challenging behavior, severe aggression, where a child is not able to sit for a therapy, even the hitting the parents, hitting the very aggressive, destroying the things in the home. So that time you need help of medications. See, otherwise these children will be, how you can manage them in the home context. If the severe challenging behaviors are there, if that cannot be managed, then it will be difficult to manage them in a least restrictive setting. So we have to decide which children need medications. As I said, all children, not every child with autism needs a medication. No, there are only selective group or subgroup of children where there is a significant challenging behaviors, and these challenging behaviors, as I repeatedly say, they are interfering with the learning. Challenging behaviors interfering with learning is the role of medication. You give medication so that you reduce the challenging behavior, so that their learning they can involve in learning. And these challenging behaviors are dangerous to a level that they are harmful to them and themselves or family members. That's a time where you need help. So but as I said, sometimes there is also these are all different schools of thought, different schools of people say why child is being on unnecessary on medication, why the this one. So but at the same time we have to be careful also, like not to put every child on a medication is also important. So for just some hyperactivity also we have to give any medication, that's also not so as I said, we have to select specific what are the target symptoms and what is the need of medication, and when you give medication is important, as I said. So you are not giving any therapy and you are just starting medication, that's also not good. So you start therapy, and if the behavior issues are still persisting and you give medication, but having said that, you give medications for a certain period of time, monitor whether ongoing need is there. So that's the way forward.
So there is another claim
Yeah.
that medicine, it triggers adolescent problems in individuals with autism and also leads to problematic adult behaviors. So is there any scientific evidence that
Yeah.
medicine causes such long-term harm to these individuals?
There is no evidence. So medicines do not trigger any long-term such behavioral change or hormonal change, because see, the important is these medications half-life is hardly say 1 day 2 day. That means if you stop medicine is not there in the body after 48 hours. So there is no question of long-term adolescence, long-term behavior issues and all. So these medications do not have that kind of any long-term. It will trigger behavior issues? No, it will not trigger. In fact, it helps the behavior issues in adolescence, but it will not trigger any behavior issues in adolescence. As I said, these medications, once you stop it, after 48 hours or after 72 hours, there is no effect of these medications. So see, only children who are requiring medications for a bit longer period of time, say 1 year, 2 year, more than 2 years, so they need bit of monitoring with as I said, some routine blood tests have to be done, say every 6 months. You have to observe them for some kind of any tremors, are they developing it. So these are the few things. And weight gain, these are the things we need to just monitor in them. Apart from this, there are no other as I said, so there are if we restrict to only what is recommended medications to use, I think that's the way forward. And also, like as I said, sometimes there is also a lot of controversial things about, so why child is requiring medications, so all those sort of things. So as I said, it's a and see, we should have the one problem is like what is the best thing is we should have a communication between different team members. Now, what happens is sometimes a therapist is saying something, doctor is saying something, the psychologist is saying things. Who parents have to believe? They have to believe either doctor or the therapist or the psychologist. Now, see, as I said, it's not a one-man treatment. It is not. It's a teamwork. You know, a doctor has a certain role, a therapist has definite role, and assessment psychologist has got definite role. We have to work in a team, and the communication has to be with the. See, this is what if you see in any premium academic centers, be it in India or outside the world, it's a teamwork. When I was in CMC, so we used to say, for example, we used to admit a child for 3 months for the training program. Okay, now the child will go to each day different therapy, speech, OT, behavioral therapy and all. We as a doctor, we go on every Saturday and see each child, what is the progress happening, and all therapists are there and they are telling that this is the progress happening, these are the These are the behavior issues which we are facing in difficulty, and we analyze what are the reasons for these behavior issues, but what are the blocks, why child is not progressing, whether these behavior issues are very significant. Yes, then there is a, we think about, oh, so we have started therapy and we have done behavioral therapy, and this child is having significant behavior issues, where that's why child is not getting significantly in the therapy. So yes, there is a need for very low dose medication. So this communication has to be a team. Once we have a team approach, I think these lot of differences in
True.
the way thing
Hmm.
would settle, because it's all about communication between us to what is best for the child, in best interest of the child. That's what we need to decide.
If you feel that this video is meaningful and useful to you, please do not forget to hit the like button and share this video. Coming back to the podcast, sir. Sir, again, many parents, they are apprehensive that these medications, prolonged use of these medications, it may cause some physical harm to their children.
Yeah.
How much of this is fact and how much is out of fear?
Yeah, so like as I said, any medications when children are taking for a longer time, they need to be we need to watch for certain things. So what is routinely recommended is, so when child is on, say, these medication, either risperidone or aripiprazole, say for a period of, say, 6 months, 1 year, so we do, as I said, one is weight checkup, very important, periodic weight, that is one. And second, some routine blood test we do, like lipid profile, fasting blood sugar, and LFT. So these are all some routine tests we do for a so once in a year or once in every 6 months, we just monitor these things. I think these are the and so one is, as I said, weight, second is these blood test, and third is tremor. Child needs to be watched for any kind of tremor or any difficulty in these sort of things, EPS, what we say. So these things we need to just monitor. Uh, I think every 6 months they need to be monitored. Yeah, every each follow-up visit they should be monitored for this side effect. But having said that, these medications, as I said, risperidone and aripiprazole, they have been tested, with a lot of rigorous scientific studies, and they have found to be these medications are comparatively safe. But they should be used in a, like as I said. We have to decide whether ongoing need for medication is there. So every 6 months to 1 year, we had to think whether if the child's behavior issues are less manageable, and we can always reduce and even stop medicine. I do reduce medicine, and I do stop the medicine, and we see, let's see for a next 6 months how they are doing. If and most children do not require medication further, and so if children require medications and that can be continued, so you just, we need to monitor for some of the medications related side effects. So that's the way forward. Yeah.
Thank you, doctor, for such
Yeah.
meaningful insights, because we feel that parents, they are
Yeah.
listening to people around,
Yeah.
and they face lot of dilemmas and
Yeah.
conflicts. It is the parents and the individuals in the spectrum who suffer the most.
Yeah.
What to do, what not to do. So I feel trusting the professional,
Yeah.
that is most important,
Yeah.
and it is also the professional's duty to gain that trust.
Yeah. Yeah. So it is, as I said, this will be a concern, role of medications. As I said, one is each children have are prone for side effects, so we need to monitor, and another important thing is, another one special problem is in autism is, just because a small dose is not working, that doesn't mean high dose will work. So that's a special problem. So we had to be careful regarding medication dosage and what frequent follow-ups. Having said that, these are the things we need to be monitored. But a lot of children, if their behavior issues are just in the manageable level, and if they are able to do well in the school. Say for example, a child is having an attention issues, child is not able to write, child is finding it difficult in writing the task, completing the task, inattentive in the class. See, child is intelligent, he's not having any significant behavior issues, only the issue is the attention problem. But at the same time, it is not that child doesn't want to give the attention. This is what we have a wrong concept. He doesn't want to focus. No, that might not, he is not able to focus. So if you correct that attention problem, and if the child is able to do well in the class, and that's the best thing for the child, because a child is intelligent, so you are just supporting the attention problem the child is having with a medication. And if you are able to monitor that, the medication, and you give in a appropriate dose, and use the what are medications which are safe and recommended for this problem in this age group. And I think that's the thing. You see, this is what we do in other specialties also. So I think what I see is sometimes when the behavior issues are as I said, hyperactivity, which is very significant, causing impairment, I think, and which is persisting despite the therapy. See, always, as I said, it is not the medications are the first line, they are the bottom on the list. Speech therapy, occupation therapy, all the behavioral intervention, be it ABA, early start Denver model, so Lova's model, and you do so. Pharmacotherapy is on the family therapy, all it's on the bottom list. You had done the thing, but still the behavior issues are persisting. And if the medication, with the very low dose of medication, if those behavioral issues can be reduced, and if they're able to do well in the school, and they are learning, and they're if they cooperate for the therapy also, the if then the skills improve, the speech improves, socialization improve, then the need for medication comes down with the time. So that is what, so it is, the medication role is to assist the child until they get the skills, or when the behavior issues are significant, self-injurious behavior, which are very difficult, unmanageable at times. So medications help in this regard. So managing these issues would definitely help parents.
Thank you so much, Dr. Kumar, for joining us today, sharing your time, your clarity, and experience into this matter.
Thank you.
To the listeners, thank you for trusting us and sharing your time and your hearts with us. Thank you so much. Until the next video comes, please do watch the video that is popping up on your screen. Thank you.